All right, we are back with you on Open. According to the latest statistics, 1 in 8 women will develop breast cancer, a startling and disturbing number. As part of Breast Cancer Awareness Month, we have invited a doctor here to Open to give some insight on the importance of getting a mammogram, and he can also talk about the very innovative 3D mammography at St. Barnabas Hospital. Please join me in welcoming the Director of Breast Surgery at St. Barnabas, Dr. Bert Peterson. Dr. Peterson, nice to have you.
Thank you. Thank you for having me.
The numbers, the 1 in 8 is positively frightening. Why is the incidence so high? Do we know?
Well, we don't necessarily know.
To solve the medical question of the ages.
You know, it's a great question, and I think it's, you know, when we say 1 in 8, I like to actually give those numbers a little bit differently, so to put some meat on it, so people really get what we're pointing to here. Because in the grand scheme of medical problems, it's almost like a public health epidemic. Because what we're actually saying is that every 13 minutes, a woman gets diagnosed with breast cancer in this country, and every 3 minutes, a woman dies from the disease. And so these are numbers that have kind of like hovered about the same. Where we are doing better is that we're now able to diagnose more breast cancers at earlier stages, which is what's really important. Because despite all of the advances that we've made in the treatment of breast cancer, like real estate, where the most important thing is location, 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 in cancer, it's early detection, early detection, early detection. So the numbers are staggering, but we're doing better in terms of the fight because we're picking up more cancers early.
Mm-hmm. You know, when you talk about prostate cancer, in many cases, in colon cancer, if you get that early detection the way that medical technology is right now, there's no guarantees, of course, but we're really doing a lot better in curing it and treating it and having people have successful results. Are we doing similarly with breast cancer?
Yeah, because of the screening. The better we're able to screen women and the more we get women to come in and get screened for breast cancer, then we're more likely to pick up those cancers at early stage. And the earlier the stage of diagnosis, the better we are at actually being able to treat and ultimately beat the disease. Like, for example, you mentioned colorectal cancer. Actually, if we screen people for colorectal cancer, we could probably eliminate the disease. Yeah,
absolutely.
So screening really plays a vital role in the treatment, the overall treatment and survival from breast cancer.
There is a great irony in our borough of the Bronx where we have the most wonderful healthcare institutions maybe of any city or any municipality in the world.
Right.
Yet we have people who don't get to access healthcare, who are, you know, I hate to put it this way, living on the outskirts, don't get treated, don't have exactly what they need. Do you have a sense that you and St. Barnabas and all the Bronx hospitals are reaching the women to get them to get that screening, or do we still have a big informational and access issue in order to be able to do what you're hoping to do?
Well, I think you're bringing up one of the biggest issues that we deal with healthcare in the country, which is the idea of equal access to quality healthcare, right? So making sure that people have access to healthcare and that they have a medical home. At St. Barnabas, we have a huge commitment to that. And in fact, we have the only mobile mammography program in the Bronx, and that mobile mammogram machine, that van goes out and hits every zip code in the Bronx. So we are out there not waiting for people just to come into the ivory tower, but we're in the communities working with community leaders and our partners, our stakeholders in this fight, and actually setting up screening events for women to meet them in their neighborhoods. In fact, our mobile mammography unit is out every day this month. And we're pretty much booked for all of November.
Do you have a sense of how many, for example, using that mobile mammography unit, how many people you get to treat and see? I know it's not sufficient. We want to get every woman out there to do it, but can you give us some?
Usually when we go out in the van, we're able to capture anywhere from 20 to 40 women in a day, depending on the location that we hit. And then those women, once we've done the screening mammograms, if we detect abnormalities, then we get them into the hospital.
That's the crucial part.
Right, and we make sure that they have access to health care. In fact, we're able to pick up on our mobile screening van, about 25% of the biopsies turn out to be cancer.
Wow.
Yeah.
And just think, I mean, it's horrible to think, but think about if you weren't doing that, you'd have 1 in 4
Yeah.
walking around with a problem that is likely going to get worse
Yeah.
and potentially be deadly. I want to ask about technology.
Yes.
And St. Barnabas, and that brought a smile to the doctor's face because St. Barnabas, one of the leaders, and you've got something new and exciting and
Yeah.
important. Tell us all about that.
Well, the newest trend in mammography right now is 3D mammography, which is where we're now able to look at the breast three-dimensionally. And we are the first hospital to have a comprehensive 3D program, meaning not only are we able to screen women using 3D mammography, but we're able to do the biopsies as well with the 3D technology.
Less painful, less intrusive.
Absolutely, yeah. It uses less time. We don't have to compress as much, which is one of the biggest complaints that women have with getting mammography. And then we're also able to get better pictures. We're able to see through any type of breast tissue, whether you have dense breast tissue, very fibrocystic breast tissue, we're able to get much, much better pictures than we did before.
I know with colonoscopies, they talk about virtual colonoscopies and all those kinds of things, but if I understand it correctly, the medical community is inconclusive about whether it's as effective as the more traditional colonoscopies. Is this 3D technology as effective, or are there still some bugs, so to speak, that need to be worked out?
Not only is it as effective, it's actually more effective.
More
and
effective than
way
the
more
traditional.
effective than
Wow.
traditional, and it's been approved by the FDA. So in fact, 3D mammography is picking up breast cancers 40% more often than in traditional 2D mammography. So it really is here to stay. It is the way of the future, and we're
Again,
happy.
less intrusive, less painful, we know about.
Right, and less radiation, which is one of the other things that women complain about. They're worried about getting breast cancer from mammography.
Do you do traditional mammographies? I guess you would do it in the mobile van, you would do traditional, or is this now the technology that is running the show?
Yeah, we've already invested in 3 units, so pretty much we're going to be phasing out 2D
Wow.
mammography. Yeah,
Great.
we're really investing in the health of our community and in the women whose lives we've been entrusted with. So this is here to stay for us, and we only, I can only thank the administration at the hospital for actually making that investment, because I see them only going further with this.
You got to. I mean, frankly, what you've told us here today is very hopeful.
Yeah.
The numbers that I started with 1 in 8, it's like,
Yeah.
oh my goodness.
Yeah.
But, we can handle this. So what would you recommend for somebody who's watching us right now, a woman who's watching us, and frankly, even men, as I understand, can have the issue, maybe less so, but do they just pick up the phone and call? Do they call their own provider? How can they access the kind of care, the specialized care that you and St. Barnabas can deliver?
Well, you can absolutely call the hospital directly at 718-960-9000 and ask for the breast clinic, and they will put you right through to my office, and you can make an appointment that way. Or you can come through a referral from your primary care physician. That's also a viable option as
People
well.
will want to know about coverage. Is the new treatment, for example, covered? Because a lot of times new treatments, well, that's okay, but my insurance provider won't cover it.
Sure. Well, we're lucky to be living in New York State. This is one of the best states if you're going to get sick, New York State. So New York State actually
Bring us,
covers.
you're tired, you're poor. and you're
Absolutely.
sick.
I tell people this all the time. I thank the people. But the bottom line is we have a free and low-cost mammography program in New York. So whether you can afford
Got
it or
it.
not, we take care of you.
Don't hesitate. Dr. Peterson, thank you for all the lives you save and for all the people that you treat and for all of our great people at St. Barnabas. Tell them we said hello.
And thank you for having me.
Folks, guess what? We have come to the end of our program. We want to thank all our guests for joining us and for viewers for tuning in. If you missed any part of the show, you can catch the recablecast at 5 and 10 p.m. on Optimum 67, Verizon Fios 33. You can watch anytime at the web at bronxnet.org. And guess what? We're no longer open. We're closed for now. We'll see you next time. Good night.